we now face really what's a bigger, the exchange decision, while it was, you know, debated about back and forth, I think appropriately so, the expansion decision is a bigger and potentially, to be honest with you, a lot more difficult decision. The reasons to do it would be the federal government is going to, like the first 2 years, they pay 100% of the cost. Right now, by the way, on Medicaid, we pay 1/3 and they pay 2/3. People are covered, they're paying most of it. That's one reason. The second reason is hospitals around, and there's a lot of, obviously, healthcare industry in this state. Hospitals are losing, long story, but made it real short, losing what's called a disproportionate share payment. That's what they get for taking care of indigent folks. And that payment is going away in relationship to when the new healthcare plan came out, where those people are now going to be covered by the new healthcare plan, so we're going to take away your disproportionate share payment. But then now all of a sudden states have the option to not expand, so hospitals could potentially be caught. And so you might think about in terms of the big hospital chains around here, but it's also a huge issue. If you're a small rural hospital, to be honest with you, you're probably just on the borderline of making it or not. If you've got a 110-bed hospital in one of our rural counties, and we have a lot of those that provide the primary medical care. Those are the reasons you'd say, well, it's a no-brainer. They're paying for it. You're going to cover more people. It'll help hospitals. Oh, by the way, healthcare is a big industry in Tennessee. It's a no-brainer. Expand. Those are reasons to do it. The reasons not to do it are this. Ultimately, we have to have a different way to address Medicaid or TennCare. If y'all remember back when Governor Bredesen was in, he made a hard cut to the budgets of TennCare by basically cutting, I think it was like about 150,000 people off the rolls. He did that after trying a lot of different other angles to pursue. But at that point in time, TennCare had gotten to be 33% of the state's budget, okay? And it was, in his words, it was eating up every new dollar that we got. So he made those adjustments, and it went down to being about 23, 24% of the budget, somewhere, I don't remember exactly, but to be a much more manageable number. Now, it's climbed back up to be 26 or 27%, and it's real easy to see what happens. As healthcare costs go up close to double digits every year, and your revenues come in only at about a 2 or 3% jump, it doesn't work. And so TennCare/Medicaid gets to be a bigger and bigger part of your budget. This year, of our new dollars, not of the new dollars that were preliminary projected, we don't know exactly, but we're projecting for next year, TennCare is going to eat up almost all of those before we give anybody a raise, before we do anything different with higher ed, before we do anything different to help take care of children in our system, before we address overcrowded prisons. It's eating up every dollar we have.